Hello, Mr. Pouncy. My name is Michelle. I'm here to give you an examination. I'm just going to be checking your heart and your lungs. I'll be asking you to say and make a couple of sounds. I'm going to be listening and auscultating, so you'll feel me palpating and everything. And I want to check lung sounds and heart sounds. Okay? All right. So the first thing I want to do, I want to check your carotid artery. And I feel here. Not at the top, closer to the middle. Then I'm also going to feel the other side, making sure not to palpate the side simultaneously as to cut off blood flow to the brain. I'm going to auscultate the carotid. With this, I'm checking to make sure that there is no trill or bruit. This is once with the diaphragm and then also with the bell of the stethoscope. Okay. I'm also inspecting his chest, make sure that everything is symmetrical. The shoulders are symmetrically aligned. The chest rises and falls symmetrically with each breath. Checking with the pads on my fingers. I want to make sure that there is no crepitus. Checking for any trapped air or anything, and there is none. Okay. I'm about to listen to heart sounds. I'm going to listen to heart sounds on each valve, starting with the aortic. Then I'll go over to the pulmonic. I'll come down to the tricuspid, which is fifth intercostal space, then midclavicular. I'll go over and I will listen to the mitral for the apical pulse. Down to the tricuspid and over to the mitral valve. And for the apical pulse, I would listen to the apical pulse for 1 minute, and we will simulate listening for 1 minute. We would get the pulse rate and the rhythm, and it is a regular sinus rhythm. And that would conclude the heart assessment. For the lung assessment, I'm going to have him sit up and face me. And we are going to do the anterior lung assessment. And I would start, and I would look and inspect that each breath, the chest moves simultaneously, the shoulders are symmetrical, chest is symmetrical, and I would have him to sit up straight. And then one of the things I want to do is check for tactile firmitis. And by doing that, when I place my hand on your chest, I just want you to say 99, okay?
99, 99, 99, 99, 99, 99.
And I would do that symmetrically to make sure that I could feel everything symmetrically. And it would let me know if there's any subcutaneous air trapping or anything like that. And I would also inspect with the pads of my fingers above the clavicle and within the intercostal spaces. Okay. The next thing I want to do, I am going to auscultate for lung sounds, starting above the clavicle. Every time the stethoscope touches your skin, take a deep breath. And doing it in a ladder motion. And doing it this way, I can auscultate upper lobe and lower lobe sounds. And that would complete the anterior lung assessment. I'd have him to turn, feet this way, sit up, turn your feet this way, sitting up, and sit up so I can, all right. Okay, and auscultating, first thing I would do, I would assess and inspect his back. And then I would check for symmetry and everything. I would also do the tactile formitis on this same way as before. When you feel my hand touch your back, I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. I would also, at this point, is when I would percuss his posterior lung fills. And you're going to feel me tapping on your back. You would just need to sit. And what I would do, avoiding the scapula on each side, place my fingers, and I'm going to go with the first knuckle of the first finger of my non-dominant hand. And I would do the same thing, avoiding the scapula. Okay. The next thing, I am going to auscultate lung sounds again. Every time you feel the stethoscope touch you, take a deep breath for me. Thank you. Good job. And then here I'll get the upper lobes. Stretch your arms in front of you. And then I'd come around here, and this will help with the mid-lung sound as well, and lower lobes. Okay. Next, there are 3 different things I can do to check for any lung consolidation. The first one is called the whispered pectoraliloquy. Every time I cut you, I just want you to whisper 1, 2, 3. Okay? And technically that should be auscultated. So I'm going to do the same thing when you feel the stethoscope touch your back, do the same thing. Okay. I'm going to do the same thing, and this time I just want you to say the letter verbally, E. Okay. All right, so we've done the bronchospony, we've done the egophony, and we've also done the whispered pectoraliloquy, and this lets me know that there is no lung consolidation at all. I've listened to, or I've auscultated all lung fields, and there are no adventitious lung sounds. There's no wheezing, no bronchi, or anything of that nature. And in doing this, I know that he has no emergent cardiac or pulmonary issues. You can turn around. This concludes my cardiopulmonary assessment. Thanks.